want to talk about the importance of ethics and trauma informed care as ethical principles within group work and group therapy specifically. So, in one of SAMHSA's other publications on group therapy, as it relates to substance use treatment specifically, they suggest that the following qualities are most important for group therapy leaders: a sense of consistency, active listening, firm identity, confidence, spontaneity, integrity, trust, humor, and empathy. And that group leaders must really role model and embody these principles, these qualities, rather than just talk about them. Much of the group therapy literature about the harms and risks and adverse outcomes in group therapy actually focus on the group leader and a leader's abuse of power, control, their interpretation of what's happening, their leadership style, and the interaction between members and the group. And so some of these include issues related to countertransference, the personality of the therapists and participants, inadequate pre-group assessment, selection error for group inclusion, conflict or rejection between participants, and individual characteristics of the participants. So these qualities, these aspects are all related to instances of harm, risk, and adverse outcomes in group therapy. Now, there really is not a lot of research about harm and risks and adverse outcomes in group therapy in general, and it's an area where we need more research. We need to better understand what are the conditions that lead to individuals in our groups experiencing harm or adverse outcomes. But from what we can tell, there's certainly something strongly related to the leader that can lead to harm, adverse outcomes, and risks in group therapy. In 2018, Riva and Cornish had a publication, and they highlight that group therapy ethics are considerably more complex than are the ethical concerns for individual psychotherapy. Yet, the amount of information on the ethics of group work is startlingly small. So, group therapy includes multiple strangers that are coming together for ongoing series of sessions together, and it involves inherent risks related to confidentiality, related to privacy, related to safety, diversity, and boundaries that are just not present in other types of therapy. Just like there's exponentially increased potentialities and opportunities for healing in group therapy, there's also increased opportunities for harm within group therapy. And most of the codes of ethics in our professions do not adequately address or provide guidance for providing group therapy, group counseling, or even guidance about working with trauma. Group work and trauma are rarely mentioned in the Code of Ethics of APA, ACA, or NASW. Instead, there are some other codes of ethics that were created specific to group work that highlight some of the unique issues that group workers are faced. And I would encourage you to familiarize yourself with those if you're facilitating groups. There's one published from a counseling perspective in the Association of Specialists in Group Work. There's another code of ethics or ethical standards published from a social work perspective through the International Association of Social Work with Groups, and a third code of ethics published by the American Group Psychotherapy Association. So all the different literature about group therapy and ethics highlights that there's multiple common ethical issues that group therapists need to address in their facilitation. And some of those include the presence of personal disclosures, documentation about our sessions, boundaries within the work, impaired professionals and self-care, confidentiality, dual roles or multiple relationships, issues that emerge related to involuntary participation in groups, concurrent therapies that are being provided at the same time as the group, providing group work or group therapy over the internet through telehealth, the standards of care in group therapy, and the competence of the group leader. So these different issues emerge within groups frequently related to ethics. And if you think about it, even something as simple as confidentiality becomes significantly more complicated in a group setting than in a one-to-one therapy setting. In a one-on-one session, the therapist is legally bound by confidentiality, and so the individual client can feel pretty assured that their session, what they share, is going to remain pretty confidential. However, in a group setting, only the therapist is legally bound to confidentiality. The rest of the group members are not legally bound. Even though they might verbally be asked to make a commitment to confidentiality, there's inherently increased risks of violations of confidentiality within the group. So I encourage you to take some time to reflect on what are some of the other common ethical issues that emerge within your own group work practice. Now, there's increased risks and ethical concerns that we have to take into consideration when it comes to providing group therapy over telehealth. And there was a 2020 publication that highlights 5 areas of concern after reviewing all of the research in the area. The first area of concern for telehealth group therapy is about confidentiality, privacy, and online security. So again, the issues of confidentiality become much more complicated. Privacy becomes much more complicated when we're meeting as a group versus meeting one-on-one. The second ethical area that emerges is the therapist's limited training or competency in providing and facilitating telehealth services. That most of us in the field, if you were trained or graduated before the COVID-19 pandemic, chances are you didn't receive any or very little training or education about providing telehealth sessions. I think educational programs since 2020 are doing a better job in integrating that, but it still remains an ethical concern. The third ethical concern is related to technological problems that can disrupt communication during the session, where we might be in the middle of a session, a therapy session, and then all of a sudden there's a internet problem and we lose connection during a really important or sensitive moment. Or somebody loses power because of a storm in their area and they get disconnected. Or somebody struggles to navigate the increasingly complex technology platforms that we're using, and it impacts their ability to communicate. So this is another ethical concern. The fourth ethical concern is a lack of research about the factors leading to effective and successful telehealth groups. And the fifth ethical concern is difficulties and risks related to emergencies that might arise during telehealth group sessions. That when somebody's in person with us and they're having an emergency, for example, a medical emergency, they're right here in front of us and we can immediately respond. But when it happens online, it's harder to know that they're having a medical emergency, and we can't immediately respond in most cases. We have to know exactly where they're physically located so that we can send emergency response to them. So these are the 5 different ethical concerns that emerge for telehealth. Now, Yalom and Lezik, in their 2020 publication on group therapy, suggest that the group leader's responsibility includes establishing a safe and secure and stable physical group space when we're doing in-person groups. And that same responsibility translates to the group leader's responsibility for ensuring secure, safe, and stable online group environment. Teletherapy in many ways is inherently aligned with trauma-informed principles. Some of the ways that it's aligned is that it provides more accessibility. It's much more easier for people to access a telehealth session than to attend in person. And there's inherent limitations that folks might experience related to geographical proximity, mobility, cost, time, that might prevent somebody from attending in-person groups, whereas telehealth makes these much more accessible. While there are some risks to privacy in telehealth sessions and groups, there's also some benefits when it comes to privacy, in that an individual doesn't have to physically walk into a therapy center or treatment center. If they're attending a telehealth group, they can just sign on to that from the privacy of their home. Another aspect is that telehealth offers much more opportunities for group attendance. If an agency is only offering one or two or a handful of in person groups, and those conflict with an individual's schedule or ability to attend, telehealth groups are accessible by people all over the place. I mean, there's some limits to state licensing, of course, but it creates far more opportunities for people to attend different groups. And in the same way, it also creates more opportunities for homogeneous groups, in that we can have more groups where there's a shared identity or a shared experience because there's more choices in group attendance. So, for example, somebody might have a really difficult time finding a group in person in their geographical area at a day and a time that works for them, that's focused on a specific aspect of identity or a specific topic or a specific community, or that's led by a therapist or a leader of a specific identity. It's going to be much harder to find in person than it is to find online, where things are going to be more accessible. For example, if a individual client is trying to find a therapy group that's specific to medical professionals because they're a medical professional and they feel like they need to be with other medical professionals in a therapy group who could best understand the unique difficulties they're experiencing in their profession. It might be a lot harder to find an in-person group for them to attend than to find an online group designed for medical professionals. Same goes for finding groups that are designed specifically for Latinx individuals or Black clients or Native American clients or Spanish speakers or Arabic speakers or Muslim clients or Christian clients or folks within a certain age range. It's just going to be easier to find groups that are designed for a really precise population or client or community or issue online than in person because there's more available. So there's many ways that the provision of telehealth is aligned with trauma-informed principles. Now, so the Association of Specialists in Group Work has a publication called Guiding Principles for Group Work. And it explicitly states that the organization views ethical processes as being integral to group work and views group workers as ethical practitioners. So they're really emphasizing the importance of ethics here. Groups can be very helpful and healing, but also can be harmful. So as group workers, we really have to be ethical practitioners, and we have a responsibility to cultivate helpful groups rather than harmful groups. So this really requires group work competencies and skills. At the same time, there's a huge absence in group work training and education for individuals in the helping professions. Anybody can complete a graduate degree in social work and counseling and psychology and marriage and family therapy and go on into a career providing group psychotherapy without receiving any or receiving very little education and training and supervision that's specific to group work. And my doctorate dissertation had a large part of it was focused on this problem, that there's been a big decline in group work training and education within graduate programs over the years, and at the same time, a big increase in the expectation that professionals are expected to facilitate groups in their careers. And this is an ethical problem, that professionals are providing services that they were not trained to provide. If you wanted to learn more about that, I encourage you to check out my dissertation, which is called Social Group Work in Action, and you can download it for free through the University of Pennsylvania's database for doctoral dissertations. It's also outlined in chapter 2 of my first book social work, sociometry, and psychodrama. And this book you can actually download for free online if you search for it. It's published open access through the publisher Springer Nature. Chapter 2 in this book includes some of the content from my dissertation about the decline and absence of group work training in social work programs specifically. So, for a comprehensive dive into group therapy ethics, I encourage you to check out the newly published book that's called The Ethics of Group Psychotherapy, which came out just a year or two ago.